Welcome all. In this video we will discuss about the instrument used for the ear examination. So let's start. So this is the first instrument. This is the self-retaining hemostatic mastoid retractor. Okay, this is the self-retaining mastoid retractor. So it is also called as Mollison's mastoid retractor. Okay, so what is the use of this retractor? Use is in the mastoidectomy surgery. Okay, to retract the soft tissue after incision. After incision, the retraction of the soft tissue and elevation of the flaps. Okay, it is the use of this instrument. And what are the structures? The next question is, what are the structures it retract? At first the screen, then superficial fascia, then temporalis muscle, and with deep fascia. Okay, and then it reaches to the periosteum. And after that, the retract the vessels. So during the retraction, the vessels end is compressed, so hemostasis is occurs. Okay, that is why it is called self-retaining hemostatic mastoid retractor. Okay, now a demonstration video. So it is the mastoid retractor, and once we press, it is self-retained. Okay, and after that, when we press the unlock, then it is unlocked. And here after given the incision, we go to the fascia, superficial fascia, then temporalis muscle with fascia, then it is used to retract like this. Okay, and after that the vessels are also retracted, so hemostasis occurs. Next instrument is tuning fork. Okay, we most commonly use for hearing assessment is 512 512 Hz. It is most commonly used, and less than 512 Hz is for assessing of vibration sense. Okay, and we also use 256 Hz, 1024 Hz for the ABC test also, but most commonly use 512 Hz for air conduction and bone conduction test like Rennie's-Weber's test. Okay, it is the tuning fork of 512 Hz, and this is the test Weber's and Rennie's test. Next instrument is oral speculum. Okay, and it is called Hartmann's oral speculum, and also it is called metallic oral speculum if it is made by the metal. These are the metallic, and this is the plastic. Okay, we use metallic and plastic both. So what is the use of this oral speculum? To straighten the external auditory canal to make the eardrum visible. Okay, as the external auditory canal is not straight, so we use for the better visibility this funnel shaped instrument, oral speculum. And also by this instrument you can do external auditory canal examination and other procedure, like along with the otoscope it can also use for the visibility and the straight pathway to the tympanic membrane as well as the external auditory canal. Next instrument is Jobson's horn probe. Okay, with ring curator. It is the Jobson's horn probe. Here is the rough surface. Okay, you can see the rough surfaces, and here we put cotton or something to clear the wax in the ear. Okay, and it is the ring curator. Here it is the ring curator. Okay, and this ring is for hook the foreign body or wax to pull out. Okay, so this is the use. At first ear wax removal, then removal of foreign body from ear. Okay, then probing of oral polyp and other mass of the ear canal, and other like it can use in the nose also for the probing of the mass and the checking the sensitivity. Okay, so after all it depends upon the user. So this is the Jobson horn probe with ring curator. Okay, so here is a demonstration video. At first we put the ring curator to detach the wax from the ear canal, and on the opposite side we put a cotton on the rough surface, and by this cotton we pulled out the wax very easily, and that's the wax removal. And it is the children, and we avoid the hard ring curator, so we just put the cotton with the rough surface and clean the wax. Here is the use of oral speculum and the probe simultaneously, whose external auditory canal is not straight. We use this.